Welcome to the Compounding Center Connections, where we talk about different health conditions with our partnered practitioners. I'm your host, Jay Gill, a compounding pharmacist from the Compounding Center in Leesburg, Virginia. At the Compounding Center, we collaborate with practitioners, create custom medications to help our patients get better. So in this episode, we have Dr. David Berman from the Berman Cosmetic Surgery and Skin Center in Sterling, Virginia. Dr. Berman, thank you for joining us on this episode. And today we're going to be talking about the RealSelf Smart Lipo procedure. Before we begin, could you please introduce yourself to the listeners and viewers?
Sure. Thank you very much for this opportunity to talk with you. So I'm originally from Toronto, Canada. I grew up there till I was 18. Then I went out to Stanford University, did chemical engineering, went back to Canada, went to medical school there, then did a full residency in general surgery because that was kind of the way they like to do plastic. So I'm actually board certified in general surgery, though I don't practice it. And then I went down to UVA in Charlottesville, did a 2-year residency and fellowship down there, and then went back to Canada because I was here on an education visa, worked there for 2 years in private practice. And then I've been back here ever since. I've been here for a long time, and I'm board certified in Canada and the United States in plastic surgery. And I'm specialized now all in cosmetics, but I used to do insurance cases as well. And just in the last 8 years, I've completely focused only on cosmetics.
Now, how long have you been in the Loudoun County area?
Showing my age, unfortunately. I came here in 92 and then got kind of famous when I did the Bobbitt case in 93. So I've been here since 92 in
Wow.
North Virginia. I've actually been in the same building. I keep moving up and down the floors, but I've actually been in the exact same location too.
Gotcha. Well, before we begin, a disclaimer. The information discussed today is for informational purposes only, not for diagnosis or treatment. So could you talk about what is Smart Lipo, and is it different than the liposuction procedures that we know and hear about, traditionally?
Yeah, excuse me. So it's really an evolution. So the other name for Smart Lipo is Laser Lipo, and Smart Lipo is like the trademark name by Cynosure, who makes the equipment. So traditional lipo has been around, probably 40 years now. And what it's traditionally done is you put somebody asleep in the operating room, you put a lot of fluid in the area, you're going to liposuction, and then you suck out that fluid. And when you remove the fluid, the fat comes with it. It's been around for 40 years. It works great. Lots of success stories. What makes Smart Lipo different is the ability to do it in the office under local anesthetic. And I always give people a little bit of oral sedation, something called Ativan, because everybody's nervous. So it makes you nice and relaxed, makes it comfortable. The way I'm able to do it in the office is I put a much higher concentration of lidocaine and a little bit of marcaine. So it's got a higher concentration, so you're comfortable when I do it. In case people are worried, I have them wear goggles so they can't watch what they're doing, because some people want to watch, but I don't let anybody watch. And also because of the lasers, they can't legally watch it. But the advantage of doing it in the office is, although liposuction is quite safe, and there's millions of cases done around the world, anytime you're put to sleep, there's always a small chance you can get a DVT, or deep vein thrombosis, which goes from your calves to your thighs to your lungs. And if you get it, excuse me, in your lungs, it's called a pulmonary embolus. And of course, sometimes that can be fatal. So there's always that small risk. Whereas if you're completely awake, you're not going to have that risk because your legs are moving. Also, if you're being put to sleep in the operating room, not only are you paying for me, you're paying for an anesthesiologist, you're paying for a surgery center, an operating fee. Also, when you do Smart Lipo, the laser tends to knock out the little sensory nerves a little bit. So they're a little bit more like your foot's asleep feeling. So there's much less discomfort after Smart Lipo. And most people, like I'd say 90% of my patients, will return to work the very next day. Whereas
Oh, wow.
Yeah, so it's really quick. Again, not 100%, but probably 90, 95%. Again, do they feel it? Yeah, that they're a little bit sore, but not terrible.
Yeah.
And it's them to be up moving. Whereas when you do traditional, most people want 3 to 5 days out of work. So it's a quicker recovery. I let people return to full exercise in 5 days, doing whatever they want. So it's a quicker recovery. So I think that's an important distinction, and the things I mentioned as well. So the difference between smart lipo and regular lipo. So as I said, regular lipo, think of it almost as two steps. You put in fluid, you suck out the fluid, and with the fluid comes the fat. Obviously, you're put to sleep. With smart lipo, the first step's the same. I put in fluid. The concentrations and what I put in the fluid are different, but the concept's the same. I'm putting in fluid. The last step's the same in that I'm liposuctioning out the fluid. But with the smart lipo, there's a middle step, and it's why it's called laser lipo. So I go into the area that I've numbed up with a little teeny fiber optic laser fiber. I always explain it to my patients. I think it was like the inside of a big pen. So it's only 1.5 millimeters or 1 millimeter connected to a big expensive laser. And I move it back and forth through the subcutaneous tissue. Every time I step on the pedal, 2 different wavelengths of laser beams comes through, and the wavelength of the laser beam is highly specific for fat. So it's essentially targeting the fatty tissues. When it makes contact or gets close to those fat cells, the heat damages the fat cells. Fat cells are sensitive to heat, so it'll either kill the fat cell or it'll damage the fat cell, and your body will resorb that fat cell. The heat will also cause the tissues to tighten a little bit, so you can get some degree of skin tightening. And so that's the middle step, and then I suck it out the fat, and then you literally put a teeny dissolving suture, a little Steri-Strip, and people just bring along Spanx or spandex or some compression garment, and they leave, within an hour or a couple, right after the procedure. And the procedure's anywhere from an hour or 45 minutes to a couple of hours. And then that day they're sleepy from the Ativan, but I want them to shower first thing the next morning. They can drive and go back to work.
So Dr. Berman, what areas can be treated by this, and how large of an area can be treated? And when you say there's only incision the size of a big pen, like, is it just one incision or multiple incisions?
Yeah, good question. So to answer which areas, it can be done anywhere there's fat, both from the neck. So, rarely you'll do jowls, but you can't, it's not so specific that you can do like under the eyelid fat or something like that. So it's got to be a decent pocket. So the commonest areas are kind of what you'd expect would be abdomen and flanks. Flanks and love handles are really the same thing. And that's traditionally where men will have it. Women, and also the submental, which is like the neck area, the central upper neck area is a real common area. A lot of people, as they age, you get a little wobbly fat there. And sometimes it's genetic and they'll have it in their 20s. So that's a pretty common area. And then areas that you'd also not always think about, bra fat's a really common area for women. Obviously, inner and outer hips, around the knee area, sometimes calf area, bra fat, upper arms. Basically, if there's fat there, I can remove it.
Gotcha.
So it's pretty much anywhere. So in terms of incisions, it really depends on the area. If I'm doing a small area like the submental area, to be one little tiny incision. If I'm doing the lower abdomen, I usually like to put 2 incisions, but again, they're only 2 millimeters because I like to be able to crisscross through an area approaching from 2 different directions. If I'm doing an upper or lower abdomen, depending on the person, I might make 5 so I can get in different directions, go towards the flanks. So you really have to customize it. So generally speaking, it's going to be 1 or 2 small incisions per area. And then obviously if you have 2 areas like 2 love handles, you have 2 incisions obviously per side.
So Dr. Berman, you mentioned about some complications. Could you talk to us a little bit more about what a patient could expect?
Yeah. So again, from my perspective, there's a difference between complications and what to expect. So let me elaborate. So what to expect? Of course, you've had a procedure. You're going to be a little bit sore. I give everybody some narcotics. I give them something called Celebrex. Some people don't need anything at all. Some people need a little bit. It's very rare for someone to need a lot, but there is some discomfort. I'm definitely doing something invasive. So I don't think of that as a complication. I think that is, normal part of the procedure. And, you'll be a little sensitive for a couple of days. I let all of my patients do full workouts, and I've had a lot of, I do a lot of athletic people as well as less athletic people. And, many of them will go running and do a full workout at 5 days. And I'll say, what was it like? And they said, hurt like heck for the first 2 or 3 minutes of running. And then that was okay. But so I don't think that's complicated. I think it's normal. Anytime somebody's working inside your body, you can get a bruise because all the bruises is a few drops of spilled blood. There actually isn't a lot of bruising in my hands with
Yeah.
Smart Lipo, but it does happen. And every once in a while, I get somebody who's really bruised. So again, I don't think of those as complications. It's just, kind of a normal thing of the procedure. Areas that are kind of fatty or a little fuller, like a lower abdomen and love handles, it's very normal to get areas that might feel firm or kind of hard after the surgery. They'll look normal. So they look at themselves in the mirror, their partner looks at it, they'll look normal. But if they take their own hand and just kind of feel around, they might say, oh my goodness, there's a little bit of a firm lump there. Again, it's just the fat reacting to the laser. And I just tell them just self massage it for 2 or 3 minutes, a couple times a day. It will get smaller and smaller. I've never heard of it lasting. So again, I don't think of those as real complications, it's just part of the healing. Anytime you have an incision, you get a scar. They're very tiny scars. They tend to fade, but there's no such thing as a scar that truly disappears. If you look at your own body, anytime you've had a full thickness cut that goes all the way through the skin, you will get a scar. People who have ethnic skin, sometimes a scar can heal with a darker color. And again, it's not really a fault of the surgeon, certainly nothing the patient can do, just the way they heal. So all those are things that can happen. If they have, flawless skin, they have to accept that there may be a little scar. Sometimes we can position them in better places, but they also have to be able to access. So to me, those aren't really complications or normal things. You, of course, can get an infection. Infections are very rare. As I said, I've done about 13 to 4, over 1,300, maybe 14. I stopped counting at that point. And literally in all those cases, I had one little minor skin infection that happened a week later. The reason why it's uncommon is the area is prepped with like a chlorhexidine, antibiotic solution. I don't give patients antibiotics. The infection rate's so low, it's not good to take antibiotics unless you need them. But and the laser is very, very hot and would kill any germs, but you still have a little weakness in the skin from an incision, so you can get an infection. So those are all things that can happen. They're not serious. They're really, to me, part of the normal healing, obviously not the infection. But it is important to go to somebody that really knows what they're doing, because I've certainly seen online and read about cases where people have gotten pretty significant burns from the laser, because if you don't know what you're doing, the laser can get very hot. There's a lot of safety mechanisms built into the laser. It shuts itself off if the temperature gets too high and things like that. But you still need to know what you're doing. And as I said, I've answered questions online with patients who have got pretty significant burns from the laser. I've heard about cases where somebody was operating the laser and actually perforated somebody's bowels. But in fact, I've heard of this on more than one occasion. They went through the muscle layer and perforated their bowels, which really shouldn't happen. But again, if people don't really know what they're doing. So it's like a lot of things, driving's a great example. Driving's pretty safe, but if somebody doesn't know what the heck they're doing behind the wheel, it's extraordinarily dangerous. So
Yeah.
I would say Smart Lipo is exceedingly safe, but it does have risks, and it is important to go to somebody that really knows what they're doing.
So Dr. Berman, you mentioned that you should see a plastic surgeon for this procedure. Why do you think it's so important to consult with a plastic surgeon over another physician that specializes in this procedure?
Yeah, so it's a common misunderstanding that people have. So when people think of a cosmetic surgeon, most people think that means that person's a plastic surgeon, but that's not at all the case. So if somebody calls themselves a plastic surgeon, it means they've done a full residency in plastic surgery. It means they've probably done at least 5 years after their MD. In my case, I actually did 9 years afterwards because I did a full general surgery. And then anybody that's a board certified plastic surgeon has done an oral and written exam approved by the American Board of Plastic Surgery, et cetera, et cetera. So it's a huge, big deal, like becoming a doctor, but it's much more training. The term cosmetic surgeon isn't a board certification. It's just somebody calls themselves something like that. So it's not a board certification. Now, they're generally MDs, but there's a big difference between somebody who's a family doctor who's taken a weekend course or watched a YouTube video on how to do this. And that would include gynecologists and stuff as well, because plastic surgery really is specializing in this. And other people, and again, I understand where they're coming from. Everybody complains about the insurance system getting squeezed by it. And obviously these are not paid by insurance. So there's a huge interest in people wanting to do it to supplement their income. But it's important for people to realize if somebody calls themselves a cosmetic surgeon, it's just a title they've given themselves, and it's not a board certification. And as I mentioned, there's some serious complications if the person doesn't know what they're doing or doesn't do a good job at it.
Okay, so good to know. Now, this procedure, at least the first time when I started to read about it, could this be used as a tool for weight loss for some people who are struggling with controlling their weight? Could you talk to us a little bit more about why this is or it's not the correct way to look at
Yeah,
it?
no, it's a great question, actually. It's really good. So it's important for people to understand, because I get a lot of inquiries. No type of liposuction, smart lipo or any of the other, various forms of are a weight loss technique. So you don't come to the plastic surgeon and say, help me lose 20 or 30 pounds. But what it does do with the right patient is it helps motivate them. Every woman and man's done, or almost everybody, has gone on a diet. They do it for a while. They don't lose as much weight. They don't see any results and they give up. The nice thing with doing smart lipo is I'm almost certainly going to give you an improvement in whatever area I treat. And then when you combine that with better eating habits, better dieting, hopefully some exercise, then you say, wow, I'm really motivated. Not only am I going to try, I can already see a result in my stomach or my love handles or my hips. And on top of that, I hate to say it, there's just the practical standpoint. I went through all this trouble. I spent this money. I went through all this effort. I
Yeah.
didn't want to quit my diet in 3 weeks. I'll feel terrible. And I've had a ton of patients who have lost, 20, 30, 40 pounds, not because of me. It's 100% them. I just help getting them motivated. And I always tell my patients, this isn't like a breast dog. If you come to me and I do a breast dog, I don't need your help. I'm going to make it bigger. I'm going to put an implant in. But when I do smart lipo for almost everybody, I always tell them this is a partnership. If you drop your total body fat down, you're going to get a better result. And conversely, if you put on 20 or 30 or 40 pounds, you're going to detract from your final result. So you play a role. This is a partnership. This isn't just all me, and you don't play any role at all in what happens long term. And then also I tell patients, like they say, well, how long? It'll last forever. If I improve your hips or improve your stomach or improve your bra fat and you don't put on any weight, that should last forever. Of course, we're going to get older. Everything, gets a little saggier, but there's no reason that you should lose those results if you keep your weight the same. And I used to do life coaching on the side as well. And I really like it because if I can get the person to transform their eating habits and their lifestyle, that's going to have repercussions far greater than they can do from an aesthetic standpoint. They're going to feel better, eat healthier. And I'm a huge believer in healthy lifestyle and healthy dieting. So it's a great tool to help motivate somebody.
Gotcha. So in all of this, I guess there's an obvious question that without going into specific costs, could you give a person listening to this, like what would be an average ballpark for such a procedure, or is it more dependent on how extensive of a procedure you do?
Yeah. So, let me just go back to one point you mentioned about the weight. So it is important to know there isn't like a magic number where somebody has to be a certain amount of pounds within their weight. But in general, like you want a BMI around, 30 or under. So, if you're a little heavy set, that's fine. But if you're 100 pounds, for example,
Yeah.
overweight, you should definitely lose weight first. This isn't something to come in when you're 300 pounds and want to lose 150 and think this will be a tool. You want to be kind of, again, I get people who are in really good shape who want to be even better. And I get a lot of people a little bit overweight, but you want to be in that BMI of 30, 31-ish or so. So kind of on that little heavier side, but not really, really heavy. In that case, again, use it as a tool to help motivate you to lose a bunch of weight and then re-examine it. Going back to what you said, like a lot of things, the more, again, as you kind of expect, the more areas I treat, the more it costs because the more time is involved. And then obviously the amount goes down each time. But obviously you're talking several $1,000s to start off.
Yeah.
This is, a couple of $1,000s, but it's going to be less expensive, for example, than the tummy tuck where I'm putting you to sleep in the operating room with a quicker recovery. So it's definitely affordable for many people. And the more areas I do, the more it's going to cost. And I will add too, one of the things I do to keep it on the safe side is, in order to be comfortable, I put a high concentration of lidocaine. Lidocaine is an extremely safe drug, but it's still a drug, and you have too much of a good thing. So as a general rule, if somebody has multiple areas to treat, especially if they're on the larger side, I'll often split up over 2 days. So one day we'll do, 3 areas, and then the next day or a week later, they'll come back and do the other 3 areas. Again, those are a little bit dependent on the size of the person. I've had some very tiny people. I'll do 4 or 5 areas at one day. And then I've had larger people. I'll do 2 areas one day, 2 areas another. So it kind of varies with person to person.
Okay. Now, I'm sure there are other minimally invasive procedures for fat reduction out there besides Smart Lipo. Could you tell us, why do you like the Smart Lipo? Like, I have heard of Coolsculpting and some other names.
Yeah.
Why do you like this one over the rest of them?
Yeah. So let me digress a teeny bit. So there's, 2 main categories. There's totally non-invasive, and Coolsculpt and Warm Sculpt fall into that. And then there's minimally invasive, which just means it's a small incision, and that's
I
Smart
see.
Lipo. There's other lasers. So going back to the totally non-invasive, so the one that has the best name recognition is something called Coolsculpting. It's
Yeah.
been around a long time. It's got huge name recognition because they spent an absolute fortune promoting themselves. They're having a major lawsuit from some famous actress or model who, to be honest, I don't follow the acting world, but one of the complications you can get with Coolsculpting. So Coolsculpting does what it sounds like. It freezes the fat. It's non-invasive. The reason why I didn't buy their machine and I bought their competitor, which is Warm Sculpting, is I'd see a lot of negative reviews. I have had a lot of patients who've gone there who have not had good results. So I don't think the success rate is particularly high. And there's some particular complications with Coolsculpting. So when you freeze the fat, there's a strange complication called paradoxical adipose hyperplasia. Paradoxical means kind of unexplained. Adipose is fat, and hyperplasia means you get too much. So it's this weird situation where you're trying to reduce the fat, and for some bizarre reason, the person will actually form a lot more fat, and it's kind of misshapen like a hot dog.
Oh,
And
wow.
then you yeah, again, it doesn't happen a lot. The other problem with Coolsculpting is because you're freezing the fat, there's nerves in the fat. So in a small percent of people, they can get nerve damage, not like a paralysis nerve, but just a chronic nerve pain that will require gabapentin. It's a little more prone for irregularity. But I think the main thing is I just see a lot of patients who have not been placed and felt there wasn't much of a change. But some people have seen good results. So again, it's not all negative. The nice thing about it is, again, there's no incisions. They're not getting any medication. They can drive themselves there. I believe they usually need 2 sessions. I bought the competitor, also made by Cynosure and makes Smart Lipo. It's called Warm Sculpting. So think of it as like 4 paddles, about a little smaller than a cell phone. You put them anywhere on your body. It's sending laser light through the skin. It's heating the fat. And then when you heat the fat, you damage the fat cells. And then you say, well, where's it go? If you melt it, your body resorbs it just like a bruise. And when I got the machine, I've got pretty small love handles, but I tried it on I had the ladies try it on, I had them try it on me. And, I will tell you, it's definitely uncomfortable. It's not terrible, but it definitely gets pretty warm. And again, what's nice about it is there's no incisions. I mean, I've had patients come to me and say, I don't want my partner to even know. I don't want them to have any marks. So that's great. Nobody will ever know you've done it. You can sneak over at lunch hour at the end of the day. It's that I explain to people, though, is it's going to be a more subtle change because it's got to be safe. It's got to be usable on different thicknesses of skin. And it's got to be tolerable. Nobody can put up with too much pain, and you, of course, can't burn the skin. So the limitations are pretty significant. So you're definitely talking about a much more subtle change. Whereas if I'm inside where the fat is, because I've made a little incision and I've numbed up the air and there's a lot of fluid floating around to keep you from getting burned, and I've numbed you up, that laser is extremely hot. So almost always it's going to be a much more aggressive change, but it's also more money. So again, for some people, they
Yeah.
might say, I'd love to do Smart Lipo, but I'm either nervous or I'm scared or there's nothing wrong with it. I just don't have enough money. Let me do something smaller. Let me work on my diet. and maybe it'll give me what I want, or maybe I'll have to come back to 6 months or a year. So I like having options for people. And I just tell them, look, at these are the pros and cons, and you decide what's best for you, or maybe nothing. I never push people into doing anything.
Well, Dr. Berman, thank you for talking to us about Smart Lipo and joining us today. You shared a lot of good information about this procedure. Now, how can someone reach out to you?
Yeah, the best way is either call the office, which is 703-406-2444, or if you go on my website, which is bermancosmeticsurgery.com, there's a whole bunch of videos on the site. You can click on Smart Lipo. We have a YouTube channel, so I've got lots of both testimonials and videos of me actually doing the procedure. So those are all good places to find out. The consults, by the way, are free. I don't charge people for consultations. We do collect a credit card, but we don't charge unless you just don't show up without giving us notice, just so I don't waste my time. But the consults themselves are free.
Well, I'll make sure to put the website and the contact information in the show notes, okay? And I'll also link to your YouTube channel. Now, thank you, everyone, for tuning into the Compounding Center Connections podcast. We hope you found the information presented today to be helpful. If you have any comments or questions, please feel free to reach out to me at j@compoundingcenter.com. Subscribe to our YouTube channel and our podcast channel, The Compounding Center Connections, and stay tuned for future episodes. Thank you, Dr. Berman.
Thank you very much. Have a nice day.
You too.
Bye-bye.